In this video, we will see determination of age by bones. We will see ossification center. What are the ossification center that appear in the intrauterine life? So, intrauterine life, first ossification center that appear is in the clavicle at 5th to 6th week. So, at 5th to 6th week at the clavicle, center portion of the clavicle, 5th to 6th week, first ossification center develop in the intrauterine life. Then at the 7th month, at the 9th month, and at the 10th month. At the 9th month, at the lower end of the femur, and at the 10th month, upper end of the tibia appear. At the lower end of the femur, we will remember CC, cuboid and capitate ossification center also appear at 9th month with the lower end of the femur. At 7th month, at the second and third pieces of the body of the sternum and talus. Second and third piece of body of sternum and talus appear. So, what ossification centers are happening are occurring in the intrauterine life at the clavicle at the 5th to 6th month, at 7th month, second and third piece of sternum along with talus, in 9 month and 10 month, lower end of femur, upper end of tibia, cuboid, capitate, and this all. Now, then we see the fusion of the bones. When the bone fusion occur at 14 years of the age, patella fuses, and for 40 years xiphoid fuses. 14 years at patella and 40 at xiphoid. Now for the mnemonic of the fusion of the bones. So 20, 21, 22. We'll see iliac crest, inner end of the clavicle or the inner end of the clavicle or ischial tuberosity. So iliac crest, IIT is the mnemonic. Iliac crest, inner end of the clavicle, ischial tuberosity. 20, 21 and 22 it fuses. So in the carpal bone, the first to fuse is the capitate. Remember, cap is the first to fuse at the 2-month, and last to fuse is the pisiform at the 12 years. So capitate is the first to fuse at the 2-month, and pisiform is the last to fuse at 12 years. So ossification center for upper limb will start from 8. So upper end of the humerus, ossification center fuse at 18 year, lower end of humerus 16 year, upper end of radius and 16, lower end 18. So it is 18, 16, 16, 18. Similarly for the lower limb, it's just reverse. It's 16, 18, 18, then 16. Is a fusion of the ossification center. Is there. So in this diagram we'll see for upper limb the fusion is 18, 16, 16, 18, and here 16, 18, 18, 16. Here also 18. Also, now we see sternum. Sternum, what we see ossification center. First, we see this structure of the sternum. So this is having one. First, there is this manubrosternum. Then first piece of sternum. Then second piece, third piece, fourth piece, and then there is a xiphoid process. We have seen already that ossification center we have seen between the second and the third piece appear at the 7th month of the intrauterine life. We have seen that at the 7th month of the intrauterine life, ossification center develops. So it is 7 month. 7 month between second and the third piece. And for the fourth piece, what is happening? So we have seen for the second and the third piece, the ossification center appear in the 7th month. For the fourth piece, it appear in the 10th month, and for the xiphoid processes appear in the 3. So 7, 10, 3, and for the second and 4, and between manubrum sternum and the first piece appear in the 5 months. So 5, 7, 10, 3 is the appearance of the ossification center. Manubrum fuses at 60, xiphoid fuses at the 40. Rest between third and fourth beat is 15, between second and third it is 20, and between first and second piece it is 25. So what all we have seen in this, so ossification center for the between manubrium and the first piece appear at the fifth week of intrauterine. Between second and third piece we have watched 7th week of intrauterine. In third and fourth piece we have watched between 10th week, 10th month of the intrauterine life. For the fourth piece itself, ossification center appears at the 10th month of intrauterine. For xiphoid process it appears at the 3 year of the intrauterine. Then we have watched the fusion of the epiphyses. The fusion here occur at the fusion of the epiphyses. You see manubrium and its manubrium and first piece of the body. They fuse. Manubrium and the first piece of the body they fuse at which age? At 60 years. Xiphoid process, fourth piece of the body and the xiphoid process they fuse at the 40. The first and then we third and fourth pieces of the body fuse at is in 15, second and third fuses at 20, and first second piece fuses at 25. So this was all. Also we have seen that patella fuses at 14, and xiphoid fuses at 40. We have seen that xiphoid was there. And intrauterine ossification center we have also seen that. So what was the trick for the 1, 7, 9 and 10 month, or 7, 9 and 10 month. So there. Now we see suture fusion. We see in sutural fusion. So first to fuse is the metopic suture at the 12 month. At the 12 month metopic suture, 1 year. Metopic suture is the first to fuse, and last to fuse is the squamotemporal suture. So it is old age, after 80 years of the life is squamotemporal suture fuse. Lambdoid suture is the 45. So what? So if this is the cranium, we will see. This is the cranium. This is the cranium. This appears the metopic suture, and between these two parietal bones, between the parietal bones there is sagittal suture. This parietal bone and this parietal bone, so this suture is the sagittal suture, and between the frontal and the parietal bone is coronal suture, and this is the metopic suture, and behind that is a lambdoid suture. So sagittal suture, sorry, it was sagittal suture between the parietal bones, and between this lambdoid suture is there. So lambdoid suture fuses at 45 years, and squamotemporal suture fuses in the old age at 80 years. So these are sutures for the old age. Metopic suture just 1 year it fuses. So best. And what about this coronal and sagittal suture? So this coronal and sagittal suture both fuses at about 30 to 40 years. Coronal and sagittal suture fuses. So best suture for the age estimation is the sagittal suture between two parietal bones. And anterior fontanelle, where it is when it is closed, anterior fontanelle is closed at 18 month, and posterior fontanelle closes at the time of the birth itself. Basi sphenoid of the skull fuses with the basi occiput at about 18 to 21 years of the age. Both halves of the mandible fuse at the 2 years of age. Both halves of the mandible fuses. Pterion of the skull at Passat at 65 years of the age. Hyoid bone also 40 to 60 years. Sacrum becomes single bone at 21 to 25 years. So what happens? Basi at about 18 to 25 years, 18 to 21 or 21 to 25. 18 to 21 basi sphenoid fuses with the basi occiput. 21 to 25 sacrum becomes a single bone. So it is about a young adult. This is happening. And what is happening in the old age? What are the signs of the old age? Squamotemporal suture, the last to fuse. You have seen pterion at the 65 years of the age. Hyoid becomes a single bone at 40 years of the age. Coronal and sagittal sutures at 30 to 40 years of the age, lambdoid suture at the 45 years of the age. So these are after 40 plus. And for the adult, we see in basic sphenoid fused with basic occiput and sacrum becomes a single bone. And both half of the mandible fusion at 2 years of the age. Now, so this was all about the sutural fusion. We have seen anterior fontanelle at about 18 months and posterior fontanelle closes at the time of the birth itself. I'll see estimation of the race. So first is the cephalic index. Cephalic index is breadth by length of the skull. So cephalic index is the breadth by length. So on the basis of this breadth, I think they take between two parietal eminence only, and length between they take between the topmost point and occiput. Topmost point and occiput. What is that point called? Do they take from anterior fontanelle, or where do they take? We will check and tell later. So this was cephalic index, dolichocephalic, mesaticephalic, and brachycephalic. Brachycephalic, they are saying earlier fusion of the coronal suture. Coronal suture uses at for 30 to 40 year coronal and sagittal suture. So based on that, 70 to 75, 75 to 80, 80 to 85. These are dolichocephalic, mesaticephalic, and brachycephalic. Brachycephalic means breadth and length are equal. Dolichocephalic means length more than breadth, and mesaticephalic length and breadth are almost equal. Almost. Length is more than breadth, but very slightly. And brachycephalic length and breadth are equal, as in Mongols. So East Asians, all uh, they are brachycephalic. Negro and pure Aryans, they are saying dolichocephalic. So the elongated mouth, they elongated head they have like that. Indian, Chinese, and Europe, most of the population are mesaticephalic. In Mongol, everything is round, face is round, their orbits are rounded, palate is parabolic. So all face is round, orbit round, palate parabolic, and shovel shape incisors. Their incisors are shovel shape. In congenital absence of the third molar. And bull tooth or taurodontism is present. Taurodontism, enamel pearls are present. So in Negroes, they are saying the Negroes, they are having a square shape orbit, and triangular shape orbit is triangular shape orbit. Triangular shape orbit is in the Aryans, the Caucasians, and Mongol there is round shape orbit. So Mongol face is round, orbit is round, the palate is parabolic. In them, third molar is absent in Mongol, and they have incisors. They have shovel shape incisors. And bull down the taurodontism is a phenomena seen in Mongol. So, but teeth, Caucasians have what the Caucasians have, Carbelis cusp is present. Carbelis cusp is present in the lingual surface of the maxillary molar. So Carbelis cusp they have in the lingual surface. So estimation of the race is brachial index, crural, cephalic, intermembral index, and humerofemoral index is also there. So BCCI for humans. So brachial index, crural index, cephalic index we have seen, and intermembral index and humerofemoral index. These are so Caucasians have the Carbelis cusp, where in the lingual surface of the maxillary molar, if we see the lingual surface of the maxillary molar, we see that the Caucasians are having Carbelis cusp. So what all we have seen, the Mongols, they have face round, their orbit is round, and orbit is triangular in the Caucasian, square in the Negroes. Mongols, the taurodontism or bull's tooth phenomena is seen. The congenital absence of the third molar. Their central incisor are shovel shaped, and the palate is parabolic. Caucasians have Carbelis cusp. Caucasians are having Carbelis cusp. So brachial index, cephalic index, crural index, intermembrane distance index, humerofemoral index are for the racial identification. So what is brachial index? Length of radius by humerus. So upper limb shorter bone, by upper limb, lower, the brachial index. Similarly in the lower limb, they have crural index. Tibia divided by femur into 100 length. And what is this next index name? It is intermembral index, I think. Length of uh, intermembral index is that length of radius plus length of humerus, length of tibia plus femur into 100, includes both upper limb and lower limb. Hair analysis also there. Uh, the cross section of the hair. Cross section of the hair is circular in the Mongolian, ovo-circular in the Caucasian, and elliptical or kidney shape in the Negroes. Cuticle of hair, they are saying there it is absent in the Negroes. Oh, and Mongols have medulla. Hair medulla is non-fragmented. So Mongols hair medulla hair is non-fragmented in the Mongols. So what all they have seen, how the race and all can be determined. Race is determined by brachial index, cephalic index, crural index, intermembral index, and humerofemoral index. What on the basis of crural index they have seen? Dolichocephalic, mesaticephalic, brachycephalic. Most of the population, Indian, Chinese, and Europeans, are in the mesaticephalic. Also, they have seen Mongols have round orbit, round face, and they have incenter incisor. They have central incisor, which are shovel shaped, and the palate is parabolic palate. Parodontism phenomena is seen in Mongols, uh, and their hair, they have seen the medullary cavity in them is non-fragmented hairs are present, and the cross section of the hair is also circular in the Mongols. Non-fragmented, circular, non-fragmented hairs are present, and they are saying carbonic cusp is present in the Aryans in the Caucasoid, and they are saying triangular is the orbit in the Caucasians, Aryans, and they are saying square shape in the Negroes. Again, they are saying the ovocercular hair are present in the Caucasoid, and kidney shape or elliptical shape hairs are present in the Negroes. That's all they have been saying, and they're saying Mongols, the congenital absence of the third molar. Now, determination of the sex is present on the bar body, as we've seen in females. Number is x minus 1. Buccal mucosa. Buccal mucosa is the best site for measure the bar body. So, bar body, these are plano-convex mass. So, plano-convex mass. Davidson body is present in the 6% of the neutrophil of the female. Davidson body is a bar and drumstick shaped body. So stick shaped body is the Davidson body. So for X chromosome, acrylflavin is the stain is the use. Quinacrine reaction for the Y chromosomes. Acrylflavin for the X chromosome and quinacrine reaction for the Y chromosome. So according to the Krogman, the accuracy of identification is achieved according to the skeletal remains. So Krogman's, if complete skeleton is present, accuracy is 100%. Identification of sex can be there. For pelvis is present 95%, skull 90%, for long bones 80%. So pelvis and skull together can give 98%. Remember, pelvis is more than skull, but together they give 98% accuracy. So all bones, we will see difference between the male and female bones. All bones in general are larger and heavy in the male and smaller and light in the female. Bony prominence, remember, all bony prominence are higher in the male except the frontal prominence. Frontal F for female, F for frontal prominence is profound in the females. Male, they are having sloping head. Sloping head is present in the male, and female, they are having rounded head. Female head is more rounded. Chin and orbit are more rounded, and uh, female head is vertical and forehead is vertical, and in the male it is sloping. Chin and orbit are rounded in the female. It is more squared shape in the male. Also, we do Ashley's rule that length of the sternum is more than 149 millimeter in the males and less than 149 millimeter in the female. So Ashley rule is the shape of the pelvis is male, it is deep funnel shape, is shallow bowl shape in the female. Pelvic inlet is heart shape in the male, and it is quite circular in the female. Obturator foramen in male, remember obturator foramen is oval, and female it is triangular and small obturator foramen. Male they are seeing the large and oval obturator foramen. Angles are less in male and more in the female, like suprapubic angle more than 90 degree, angle of mandible is 125 degree. Body indices are less in female, body indices are more. So what all we have seen that body indices are less in general in the male and more in the female. Sciatic notch index is the best bony index to differentiate. Is more in the female. Is 5 to 6 in female. Carpobasal index is the only index that is more in the male. The breadth of the first sacral vertebra divided by the base of the sacrum. The breadth of the first sacral vertebra divided by the base of sacrum. It is 45 more in the male and less in the female. Diastole index, Washburn index, or the ischiopubic index is high in female. Preauricular sulcus, it touches sexual character. It's frequent and deep. Preauricular sulcus in the female. So, gelotic line, it is sacral part and pelvic part. Pelvic part is more prominent in the female, while sacral part in the male. Greater sciatic notch, they are saying best parameter. Best bony index was sciatic notch index, and best parameter was the greater sciatic notch. Greater sciatic notch is large, wide, and shallow. But the male it is narrow, small, and deep. Ischial tuberosity, female they are having everted and male they are inverted. Ashley rule we have seen more than 149 and less than 149. Also there is Hardy's law that the body of the sternum is twice that of the manubrium in the male, but it is less than twice in the female. Then Colonel Victor Barker case was with the concealed case. We have seen Sydney shark arm case was associated with tattoo. And they are also saying about the age of the scar determination. If in 5 to 6 days within a week, it is red inflammatory scar. Then from red inflammatory, it become pale, soft, and tender. Then it become brown, glistening, and tough. Then become white and non-tender. So first it is pale, soft, and tender. Then brown, glistening, and tough. Then it become white and non-tender after the 6 month of the scar. In 2 to 6 months, brown, glistening, and tough. In 2 weeks to 2 months, it's pale, soft, and tender. Vascular. So because it's vascular, it is caused to be soft. Red and inflammatory, it is angry scar. So what all we have seen in this sex determination, what we have seen sex determination, the best parameter is by the what we have seen is by the sciatic notch. Best parameter for the sexual determination is the sciatic notch. By sciatic notch, we can bestly differentiate. Sciatic notch is larger, wider, and shallower in the female as compared to the male counterpart. So sciatic notch, we can differentiate, and for also all indices we remember that they are more in the male, more in the female that compared to the best index was the sciatic notch index, which is 5 to 6 in the female. And except the carpobasal index, which is the breadth of the first sacral vertebra divided by base of the sacrum, it was more in the male. Other index like Washburn index or ischiopubic index are more in the female. Preauricular sulcus or tertiary sexual character uh, was characteristic of the female. Ischial tuberosity is seen whether it is everted in the female and inverted in the male. Angles are more obturator foramen. In male it is oval. Only the obturator foramen is triangular in the female, not oval. All foramen are generally oval in the female. Shape of the pelvis, it is a deep funnel shape in the male, flat ball shape, or more of a square shape. Square shape pelvis. Male, it is a deep funnel shape, looking like triangular. Pelvic inlet is heart shape and in the uh, and circular shape in the female. Obturator foramen is oval, Angles, you know that angle of the mandible more than 125 degrees, suprapubic angle more than 90 degree in the female. This was the also was in Ashley rule that more than 149 millimeters the length of the sternum, and Hartill's rule. So Ashley rule and Hartill rule was that the body of the sternum is 2 times that of manubrium. So this was all for the sex determination male and female. X chromosome acrylflavin stain and quinakin reaction for the Y chromosome. Also we have seen that all bony prominence are more in the male except the frontal prominence. And also about the forehead we have discussed, chin and orbit we have discussed, length of the sternum we have discussed. So all we have seen from top to first. It was general that all bones are larger in the male all bones are larger and head. Then we have seen all general, all the bony prominence are more in the male except the frontal prominence. And we see the forehead, it was sloping in the male but was vertical in the female. And chin and orbit are round in the female while they are square shape. Then the length of the sternum, the Ashley's rule we have seen. Then we talk about the pelvis. Pelvic inlet. What about the pelvic inlet? The heart shape in the male and more of the circular in the female. And pelvis we have seen that it is deep. Pelvic inlet is a deeper deeper funnel shape in the male, but flat oval shape or square shape in the female. And we about seen about the obturator foramen. Obturator foramen was triangular in the female, but it is oval in the male. And we seen that all bony indices are more in the male, and sciatic notch index for the best index, which was male. Other Washburn index or ischiopubic index also in the female they are high. Only the carpobasal index which was 45. It was higher in the males. Also, we have seen the ischial tuberosity is inverted in the males and inverted in the females. And uh, we have seen the sciatic notch which was best parameter. Sciatic notch with larger, wider, and shallower was in the females. Also, we have seen the gelotic line. Males, the sacral part is prominent, while the pelvic part is more prominent in the female. So Ashley's rule, Hertel rule, we have seen scar estimation. We have seen that 5 to 6 days it is red angry scar, red inflammatory scar, or the angry scar. 2 week to 2 month it is pale, soft, and tender. Then it's brown, glistening, and tough. And after the 6 week it has become white and non-tender. In coroner Victor Barker cases for the sex determination. So this was all. So see, chins, orbit, they are circular, and according to the Krogman, the accuracy of identification is achieved when complete skeleton 100%, pelvis more than skeleton combined they are having 90%, 98%, and long bones only 80%. So we see in the racial differentiation we have watched. Hair analysis we have watched that hair are circular in the Mongolian, over-circular in the Caucasian, elliptical or kidney shape in the Negroes, and cuticle of the hair is absent in the Negroes. On the basis of the hair, we have seen that here we have seen that medullary canal is there, hair cortex is there, then outside the cortex cuticle is present. So this cuticle they are saying absent in the Negro, and medullary canal is long and non-fragmented in the Mongolians. And we take the cut section of the hair, they are saying that is cut section of the hair, they are saying that cut section is circular. Cut section is circular in the Mongolian. It is kind of a over circular in the Aryans or the Caucasians, and elliptical or the kidney shape in the Negroes. Also, there's told about several index, that brachial index, crural index, cephalic, intermembrane, and humerofemoral index. When they talk about the differentiation in Mongols, the orbit cavity, the carbelis cusp in Mongol, the taurodontism of bulls' teeth. Let's talk about brachial index, cephalic index. They have talked about what was that. breadth by length, oligocephalic, mesenterocephalic, brachycephalic. Talked about the fusion of the sutures between 18 to 21 and 21 to 25. Basis, sphenoid, basi, occiput, and sacrum they are talked about. Pterion they are having the 65 at the old age. Lambdoid at 45. Coronal and sagittal at 30 to 40 years. Squamotemporal at last at 80 years. Both half of the mandible at the 2 year. Lateral skygram is for the fusion of the sutures. Lateral skygram is the X-ray taken for that. Hyoid they are saying fuses at 40 to 60 years. Hyoid fuse at so at old age. Hyoid fuse at 40 to 60. Pterion at 65. Squamotemporal suture, coronal and sagittal at 30 to 40 year. Lambdoid at 45 year. Anterior fontanelle at the 18-month. Posterior fontanelle at the birth itself closes. Here they are saving 7 3 7 10 and 3 rule, 5 7 10 and 3 rule. Here 60 years, 40 years, 15 20 25 years. Patella at 14, Gifford at 40. They are saying about iliac crest, inner end of clavicle, ischial tuberosity. First carpal bone is the capitate, last is the pisiform bone. Capitate at 2 months and pisiform at the 12 years. They are saying. So capitate is the first carpal bone to fuse, and last to fuse is the pisiform. Then we've seen appearance of the ossification center 1 7 7 9 and 10. 5 to 6 week is for the clavicle. 7 9 and 10. 7 months they are saying appear second and third, between second and third piece of the body of the sternum and the talus. Now they're saying lower end of the femur, upper end of the tibia. Lower end of the femur they are also saying capitate and cuboid. Capitate and cuboid, not calcaneum, capitate and cuboid. There is ossification center appearing in the intrauterine life itself. This was all about in this chapter. So the red inflammatory scar, pale soft tender, brown glistening tough, white non-tender after the 6th. Also seen Colonel Victor Barker test. This is all